Hello, it's Donna with Yoga for You. And today I'd like to offer, I'm here up in my small yoga room, and I want to offer a chair class for you today. So this class is going to be on cultivating awareness. So we just become a little bit more aware of how we're feeling, what's going on in our bodies. So you're going to need a few things. Obviously, you're going to need a chair. I've got my chair placed on a yoga mat so that it doesn't slide on my hardwood floor. If you're on carpet, then that's fine. Another thing you're going to need for your practice today is some sort of strap or belt. If you don't have a classical yoga strap available, then see if you can find the belt off of a robe. They're oftentimes soft. Sometimes a necktie will be long enough. See if you can find something. So you can pause the video, run out, and get what you need for this. So we're going to start out. I'm going to sit back onto my chair so that I'm using the back of the chair for support. Sit up nice and tall, rooting the feet. Now, if your chair is a little taller than mine, you might want to get something to place under your feet, whether it's a yoga block or maybe a stack of books or something that you can feel really grounded. If you're sitting back and your legs or your feet are dangling off the floor, we don't get that same feeling of being grounded as we would if we can press our feet down into the floor. So sit back nice and tall, rooting the feet down, and then just cultivate some awareness of your own spine. What does your spine feel like at this moment? And I'm not referring to whether you're feeling pain or something, but more, do you feel a lengthening through your spine? Roll your shoulders a few times. I'm going to turn my lights just slightly down, just a little bit. I feel kind of like I'm getting a suntan right now. So relax the shoulders and allow your eyes to drift closed. And take a moment here and cultivate an awareness of your own surroundings. Just notice what sounds you can hear either outside of the space you're practicing in or within your space. And try not to label these sounds that you might hear or look at them as a distraction, more that they're just part of your space at this moment. And notice the ambient temperature of the room. Just notice how the floor, whether it's a yoga mat or carpet, tile, wood floor, feels beneath your feet. Just cultivate that awareness, whether your feet feel fully rooted down or do you feel like you have a little more weight to the pinky toe edge of the foot or the inner foot. Notice how your sits bones, those bones in each butt cheek, feel on the chair. Now, my chair is not upholstered or padded, so I can get a more definitive feel of my sits bones. But whatever you might be sitting on, just notice whether you feel like you might have a little more weight towards the left side or the right side. And then cultivate this awareness of your spine. Notice the natural curvatures of your own spine. How it naturally curves slightly in the lower back, the lumbar. How the spine curves slightly out towards the back of the chair, in the mid-back, the thoracic spine. all the way up to your neck. And then just notice the placement of your own head. Is your head stacked over the axis of the spine, or are you allowing your head to droop forward? See if you can align yourself. And then imagine you're pulling up through the crown of the head, just slightly up towards the ceiling, creating a bit more length here. And now bring your awareness to your breath. If possible, keeping the lips softly closed as you breathe in and out through the nostrils. See if you can get a nice even cadence to your breath. Breath in and breath out. This may be your first yoga practice ever, or you may have been practicing for years. Either way, one of the mainstays of yoga is to be aware. Now notice where in your body you're feeling the most movement with the breath. Notice if it's your chest rising and falling, if it's your abdomen, if it's your rib cage, just become aware. And then I invite you to place one palm on your lower abdomen beneath the navel. And imagine you're breathing into the palm of this hand. As you inhale, feel the abdomen gently expand into the hand. And as you exhale, feel it gently contract back towards the body. This is referred to as diaphragmatic breath. It's a more effective and efficient way of breathing. And notice if you're breathing diaphragmatically, how the chest is hardly even moving at this point. You're taking this breath deeper into the body. There's a myriad of benefits for breathing in this way. One is that it helps to massage the pelvic floor, creating health in the pelvic floor muscles. It creates a greater intake of oxygen exchange in the body. Breathing deeply triggers the parasympathetic response in the body. That is the nervous system relaxing and calming. And you can release that hand that was on the abdomen and open the eyes. And we're going to move towards the end of our chair. And so we're no longer utilizing the back of the chair to create this long spine. So as you move to the end of the chair or the edge of the chair, just making sure you have an awareness of where the chair's at, see if you can find that same length in your spine without the use or the benefit of that support. Let's do some movements of the spine. So the spine has 6 ranges of motion in it. So we're going to work through the spine a little bit. Place your hands on your thighs or knees. We're going to do a few cat-cows. Inhale, start to arch your back. Bring your chest forward. Look up just a little bit without dropping the head all the way back. Now as we exhale, the chin starts to tuck towards the throat. Lean back and draw your navel to your spine. Let's keep going. Inhale, stretch through the front of the body. Exhale, move into the back body. Inhale, this is extension of the spine. Exhale, flexion of the spine. Keep going. Three more. Two more. Last one. And then come right back to center. So let's do some lateral flexions of the spine, or we know them as side bends. Grab the chair with your left hand. Inhale your right arm up and overhead. And as you exhale, tilt yourself to the left. Now, if this bothers your lower back at all, bring it back until you feel no pain here. And then inhale up, exhale into a side bend. Inhale up, exhale. One more time, breathe in, exhale into your side bend and pause here. See if you can roll that right shoulder back just a little. And if it doesn't bother your neck, look up like you're peeking right underneath that armpit. And then inhale back up and exhale, release your right hand down. Hold on to the chair. Inhale the left arm up towards the ceiling. Exhale into a side bend. Breathe in upright. Exhale. Inhale. Exhale. Now last one. Inhale upright. Exhale into your side bend. See if you can roll that left shoulder back and peek under that left armpit. And then inhale upright and exhale and release the hand down. Now the last ranges of motion of our spine is the rotation. Bring your arms out, turn your palms forward, and then bend your elbows, coming into this goddess pose or kind of cactus shape. If this bothers your shoulders, allow the elbows to drop a little bit more. Shoulders roll back, inhale here, and as we exhale, rotate the torso to the right. Inhale center and exhale left. Breathe in and out. Breathe in and out. One more time on each side. Inhale and exhale. Inhale and exhale. Inhale, come back to center. Extend those arms out to the side and release them down. Roll those shoulders a few times. So whenever we practice yoga, whether we're on the floor or whether we're in the chair, we always have to cultivate this awareness of listening to the body. You know your body, what works for you, what doesn't work for you. So not every exercise or posture that I demonstrate is going to work for you, and that's okay. So make sure you're listening. If something is causing pain, back off or stop doing that exercise entirely if that particular exercise is just not for you. All right? So from here, we're going to heel toe the feet just a little wider. This way I have a little bit more, a wider stance, so I feel a little bit more stable in my seat. We're going to start to do some diagonal reaches. And the reason I like to do these is not only do they help to strengthen these core muscles that run down the side called the obliques, it also strengthens the muscles and stretches the muscles in the back called the quadratus lumborum muscles. So we're going to take the right arm and we're going to reach it across towards the upper left like we're reaching for something on a high shelf. And we're going to come down and switch. Left arm reaches and come down. Keep alternating. Reach and reach. Two more on each side. Reach, reach. Last time. Right arm reaches, left arm reaches. Now we're going to come across midline. Right arm is going to reach like you're reaching for a remote and come back. Left arm reaches. Keep going. Reach and reach. Two more times on each side. Reach it. Reach it. Last set. Reach and reach. Now we're going to try to reach for something down by our foot. So take your right hand, reach towards your left big toe and come back. Remember, if this is bothering your back, don't come down as far. Two more time on each side. We're going to reach and reach. One more time. Right hand reaches, left hand reaches, and come back to center. Now we're going to put that together and we're going to do one time each side, and we'll do 3 rounds of this. Now what this starts to do is we have to remember the choreography, the movements. So this starts to work with the brain, the neuroplasticity. And here we go. We're going to start with that right hand and we're reaching to a high shove. So reach and left. Now we're going to cross midline. Reach and reach, and now down towards the feet. Reach and reach. Go back up high. Stretch. Stretch across midline. Stretch. Stretch down by your feet. Last round, up high. Across midline. Down by your feet. And come back to center. Hold on to your chair. Come up onto your tippy toes. And then let's just windshield wiper the legs a little. If there's any pain in the knees while you do this, try less movement, less range of motion, or just forego the exercise entirely. And then come back to center. I'm going to bring my feet almost together, and we're going to do something called a half sun salutation, okay? Now, the first round, I will not go all the way down, as in a deep forward fold. For those of you that might have osteoporosis or lumbar disc issues and folding all the way forward is just too much on the spine, the first one I will modify and then we'll move from there. Hands down by your side. I'm going to turn my palms forward. That's going to help roll the shoulders back or externally rotate the shoulders. Here we go. Inhale, arms overhead. If they won't go all the way overhead, don't worry about it. On the exhale, we start to fold. I'm going to bring my hands to my shins, fold forward and look down to my big toes. Inhale, come halfway up, long spine. Exhale, fold again. Now inhale, long spine, reach your arms up. Exhale, bring your palms to your heart, Anjali Mudra, and release your hands down. Now that's the modification. This next one, I'm going to go all the way to the floor because I can. Just because you can doesn't mean you should. Listen to your body. Inhale, arms up, look up. Exhale, fold forward. I'm going to reach for the floor or my ankles. Inhale, hands to your shins, lift up halfway, lengthen. Exhale, fold back down. Inhale, lift up, reach up. Exhale, bring your hands to your heart. Release, hands down. One more time, just like that. Inhale up. Exhale, fold forward. Inhale, halfway. Exhale, fold. Inhale, rise up, reach. Exhale, close the pose. Release the hands. So we're going to do the same thing, but I'm going to add a little twist to this. Inhale, arms overhead. Exhale, fold forward. Inhale, halfway. Exhale, fold forward. Inhale, your right arm up. Reach up. If this bothers that right shoulder, bring the hand to your hip and roll the right shoulder open. Left hand can come up higher if that feels better. Come back through center fold. Inhale, left arm up or modified. Come back through center. Inhale, rise up, and exhale, close the pose. Release. Let's do that one more time together. Inhale up. Exhale, fold forward. Inhale, halfway. Exhale, fold forward. Inhale, left arm rises. Exhale, fold. Inhale, right arm. Exhale, fold. Inhale, rise up. Exhale, bring your hands to your heart. Release the hands, find that breath. Now heel toe your feet wide, and my feet are actually going to come off the mat. Now watch alignment. I'm always talking about making sure your knees track. If you have no idea what I'm talking about, I don't want my toes facing out diagonal and my knees rolling in. That's just too much on the knees. So whatever direction the center of my ankle and my toes are facing, that's where I'm trying to face my knees. So however wide you choose to go with your legs, set yourself up, bring your hands to your thighs. Inhale, shoulders relax, lift your chest. Now exhale, bend your elbows and hinge forward. Make sure you don't topple off your chair. Look down. Now everyone, draw your lower belly in towards the spine like you're zipping up some snug, low-riding jeans. And then rise up. We're going to do that 2 more times. Breathe in here. Exhale, bend your elbows, hinge forward, which means straight back. Rise up and pause. 1 more time. Breathe in. Exhale, hinge forward. Inhale, rise up and pause. Now let's take a little twist. I'm going to bend my right elbow, press my left thigh away, and look over my right shoulder. Make sure no one's sneaking up on you. Come back through center. Bend your left elbow, peek over your left shoulder. And come back to center. Let's do that again. Peek over the right shoulder. Come back, peek over the left shoulder. And come back to center. Then heel toe those feet in. Now grab hold of your strap, whatever you're using. Take your strap, loop it over your right foot. Now try your best not to play tug of war. That puts too much tension across the shoulders, the arms, the upper body. If you would like, you can take your strap, roll it once around your fist, and it gives you a little kind of handle if you prefer to do that. Now lift that right leg up. If you're unable to straighten the leg, try dropping it a little lower. You don't have to have your leg very high. Shoulders relax, chest is open and spacious. So we're trying to get a nice little stretch along the back of the right leg. Now start to lift up. I'm going to turn sideways for just a moment. Notice if as the right leg lifts, if you start to compensate by leaning back. Lift up and you might have to drop the leg. Do your best to keep a nice erect spine here. If your knee is bent, that's fine as well. Don't get too attached to the aesthetics of a pose. Feel into it. Does it feel good for you? Now, if you want to try to go a little higher, you can. Keep breathing. Now, lower that leg, but hold it up. Unhook the strap and see if you can pause. Let's hold for 5, 4, 3, 2, and 1. Set it down. Rub out the right thigh. These are big quadricep muscles, 4 big thigh muscles. And these muscles, we want to keep them really nice and strong. When they begin to atrophy or weaken, what happens is then we start to have a harder time getting up out of chairs, off of a couch, even off of toilets. So it's that important. Now take that strap, hook that left foot. Maybe wrap the strap around the fist if you'd like. Lift that left leg up. Now check in with your spine. Lift. The center of the chest, the sternum, draws away from the navel. And that helps to lift us out of that rounding into the lower back. Pause here, breathe. And if you feel like you want to start to challenge yourself by lifting the leg up higher without rounding into that lower back, you can do so. Keep breathing here. 1 more breath. Now bring the leg down a bit, unhook the strap, and hold the leg in place. You can feel these quadriceps working. Hold for 5, 4, 3, 2, and 1, and release. Rub that leg out. Now set your strap aside for just a moment. We'll come back to it. I want to keep working on the legs a little bit. We'll tire the legs out and we'll move back to the upper body. So you can hold on to your chair. Make sure you feel nice and stable, secure. Extend your right leg out and flex the foot, okay? This is called dorsiflexion of the ankle. So this nice flex, I'm even sparkling my right toes out a little bit. Sit up nice and tall. Check your awareness. What is going on in the back? From here, we're going to lift and lower that right leg without letting the foot actually touch the floor between sets. Here we go. Lift up and down. 1, 2, 3, 4, 5. We're going to 8, 6, 7, 8. Hold it. Check in with your lower back. Lift your chest away from the navel and set it down and draw that foot in. Extend the left leg. Toes should be pointing up. Sparkle your toes a little. And here we go. We lift and lower. 2, 3, 4, 5, 6, 7. Last one. 8. Hold it and lower it. Bring it in. Rub out those legs. Now, if you can't quite get to 8, that's fine. Do as many as you can. If your leg's not lifting very far, that's fine too. I'm not here in your home to grade you. You do the best you can. Now what we're going to do is we're going to do some soccer kicks. So we're going to start by lifting your right knee up and lower down without touching. 2, 3, 4, 5. This works the hip flexors. 7 and 8. Now hold it up and kick like you're kicking a soccer ball. 1, 2, 3, 4, 5, 6, 7. Last one and 8 and set it down. Move to your left knee, up and down, lift it up and down. 2, 3, 4, 5, 6, 7. Last one, 8. Hold it up. Kick your soccer ball. 1, 2, 3, 4, 5, 6, 7. Last one, 8. And set it down. Okay, we're almost done. Don't give up on me yet. Right knee, we're going to hinge it open. So if you've had hip replacement surgery or you're needing it, if your doctor kind of gave you a little warning about external rotations here, then be really mindful of this, less range of motion. If it's hurting in your hips, don't move the knee out so far or you might have to skip this entirely. Hold on to your chair, lift that right knee up. Then we're going to hinge it open. My foot is flexed and closed. 2, 3, 4, 5, 6, almost there, 7, last one, 8, bring it in and set it down. Lift that left one up, flex the foot and open, close. 2, 3, 4, 5, 6, 7, one more, and 8, and release. Rub those legs out, shake them out a little bit. Good job. Now, rise up onto your tippy toes. Notice if your ankles want to splay apart. We want to try to avoid that. So imagine you put a little block between your inner ankles and you're squeezing towards midline, towards those inner ankles. And then lower the heels, come up, lower and come up. This is great to do if you have something to hold on to, say a countertop, and you can do this standing. It's wonderful for not only strengthening the feet and ankles, which can help prevent falls, but also for activating those calf muscles, which help to move lymph fluid through the lymphatic system. And let's go for 5, 4, 3, 2, and 1. Take that right foot forward, point and flex. This is called plantar flexion, dorsiflexion. And now rotate that right ankle one direction and go the other way. We want to keep our ankles really strong and release. Point that left foot forward and flex. The stronger we keep our feet and ankles, then if we're out walking and there's like an uneven curb or something, and you start to twist your ankle and fall over, your ankles are strong and can bring it right back. We want to keep that. Rotate that left ankle one direction, go the other way, and bring it down. So let's come back to that strap. Go grab hold of your strap. I'm going to hold the strap just slightly wider than my shoulder width. So then relax the shoulders away from your ears. Bring the strap down as if you're touching, you're resting it on your thighs. Then we're going to bring it up. It doesn't have to come high. And back down. We're going to do this a few times. So depending on the health of your shoulder joints will depend on your range of motion. If this bothers your shoulder, just come to a small range of motion. If you can tolerate more, then we start adding more. I'm keeping the strap taut between the hands. Let's do 3 more. For 3, 2, and 1. And bring it down. Roll those shoulders a few times. Now grab hold of the strap again, same grip. Bring it up shoulder height. Relax your shoulders. So I'm taking my shoulders and I'm drawing them back. That's a retraction of the shoulders. So instead of them rounding across the upper back, I draw them back and sit up nice and tall. Gently pull with your right hand and see if you can rotate. Doesn't have to be far, especially if you have osteoporosis. Don't go too far. And we're just rotating here. We're keeping the strap taut. And when I rotate to the right, I'm pulling with my right hand. When I rotate back to the left, I pull with my left hand. Let's do 1 more on each side. And then come back to center and release. Roll those shoulders. If you're feeling a burning, this is normal. Good. Now take the strap, same thing. We're going to bring it overhead if that's possible. Slide the shoulders away from the ears, and I'm going to gently pull down with my right hand, move into a side bend, and up. Down with the left. You don't have to go far to feel something. Keep breathing. We're cultivating the awareness not only of the movement, but of the breath. 1 more time on each side. Come back up. Slowly release. Oh, and roll those shoulders. Good. Let's take that strap. Set it off to the side. Take your palms forward and spread your fingers as wide as you can. Now make fists and open. This can be really beneficial if you have arthritis. We know arthritis oftentimes settles in the hands. We might notice it in the hands first. So we want to keep range of motion, movement in the hands. Arthritis doesn't just go away, but you can slow the progression, but we've got to keep moving. Now rotate those wrists one direction and go the other way. Gently shake out the wrists and bring your hands down. Shoulders are relaxed. And we're going to just do some range of motion in the neck. Now this is just kind of my own thing. I don't want you to drop the back of the skull, the occipital bone of the skull, all the way back over the neck, because that does kind of crunch in or compress those cervical vertebrae. So instead, I take 3 fingers. I feel like I'm doing like that Boy Scout thing. Take 3 fingers, bring them behind the neck, and then start to lift your chin, gaze up, and just notice at what point you start to crunch those 3 fingers. And you've gone far enough. So that's just kind of a little reminder. Let's bring our chin down to the chest and look up, remembering those 3 fingers behind the neck. Look down and up. Now, if you're hearing any snap, crackle, and pop in the neck, as long as it's not accompanied by pain, it's pretty normal. It's called crepitus. And one more time, and then look straight ahead. Bring your chin parallel to the floor. Look over your right shoulder and center and left. So we want to maintain this range of motion, especially when we're driving. We want to be able to look over our shoulders as we drive. So it's important to keep this range of motion in the cervical spine. One more time on each side, and back to center. Now bring your chin towards your throat, or the notch at the base of your throat. So what I'm not doing, I'm going to turn sideways, is bringing my chin down to my chest, because then it rounds. It encourages this rounding in this upper back. So lift up nice and tall, and let the chin drop towards the notch at the base of the throat. And then start to make like little U shape. So just half circles here. This is where you might really start to hear some of that snap, crackle, and pop. One more time. And then come back to center, gaze forward, let your right ear drop towards your right shoulder. And as you allow the weight of your head, and the weight of our head is pretty heavy, as long as you allow the weight of your head, you're going to probably feel this nice stretch along the top of the left shoulder and along the left side of the neck. So the upper trapezius muscles and the sternocleidomastoid muscles. If you want a deeper stretch, let your left arm drape off the side of your chair. Feel almost like you're holding a weight. It gets a little heavier. If this feels too much, then bring that hand back up to the thigh. Now, if your left arm is dangling, bring it up first. Take your right fingertips to your right temple and assist your head coming back to neutral. Allow left ear to drop over left shoulder, and just pause there, allowing the head to become a bit heavier. Stay here, or drop that right arm, let it drape off the side of the chair. And then bringing the right hand back up, take your left fingertips to your left temple and assist your head back up. Roll those shoulders a few times. So now let's go ahead and scoot to the back of the chair. So again, root your feet down. If you're not able to here, place something under your feet so you feel really rooted. I want you to cultivate that awareness of feeling stable. We're sitting up tall. Lowering the lights. So at the close of every yoga practice, we do something called Shavasana. And Shavasana is a way to relax the mind and body, to assimilate our practice. Either just rest your hands lightly on your thighs, or if you'd like, you can place the right palm, right hand on top of the left in Dhyana Mudra, letting the thumbs join together. Just close your eyes. And just as we began our practice today, start to cultivate that awareness again. Notice what sounds are either outside of the space you're practicing in or within that space. Without judgment, just being aware. Notice the ambient temperature, any air that may be caressing the skin at this moment. Notice your own temperature of your body. If you built up a little bit of a sweat during practice, I certainly did. Allow the awareness to sink even deeper as we start to observe our own breath. Notice if you're crunching your eyes, allow them to soften behind the closed lids. Soften the space of the forehead and the space between the eyebrows, the bridge of the nose. Relax the cheeks. Relax the root of the tongue within the mouth. Allow the eyes to the teeth to slightly part, allowing the lower jaw to relax. Just feel one with the body, a cohesive unit between the body, breath, the space that holds you, surrounds you. Notice how the mind, the thought processes have slowed down a bit. Trying to relax that chatter or that monkey mind. Just listen to your own breathing. This is about cultivating awareness of the present moment. Not the breath that came before, not the breath that's going to come after, but the breath in this moment. Our body in this moment. Any sounds in this moment. Cultivating a strong awareness. You can stay here as long as you need or want to. Just enjoying this quiet space that you've created. I thank you for joining me today on this journey of this chair yoga practice. Stay tuned for more. The light within me bows to the light within each of you. Namaste.